Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Sangeetha Balakrishnan. Dr. Balakrishnan is a cardiologist with the Washington Township Medical Foundation.
So we're here today to talk about strategies to help lower blood pressure and cholesterol. So I thought let's start off with a little bit of facts about how prevalent or common hypertension, cardiovascular disease is common in the U.S. So these numbers are based from a statistical report from the American Heart Association in 2018. And they noted that about 1 million people will have a heart attack or die from a coronary event each year. About 16.5 million who aged greater than 20 years are living with coronary heart disease. There are 795,000 people that will have a stroke per year. 356,000 will have cardiac arrest outside the hospital. 23 million people are living with type 2 diabetes. 103 million are living with high blood pressure. 6.5 million are living with heart failure. 38% of adults were considered obese in 2014. And, about 15% of us smoke still. So the numbers are staggering and they're concerning, and we need to become more aware of what we can do to better educate ourselves and focus on primary prevention instead of treating after the fact. So if we focus on first high blood pressure, hypertension, this kind of shows you what the prevalence or how common high blood pressure is across the country. And luckily we're in California, so the percentage is less. If you look at the lighter the shade, the less prevalent or less common, and the darker the shade, which is the darkest red, it's more common. So California falls under, a less percentage range, but still about 1/4 of Americans in California have high blood pressure. So what is high blood pressure? It constitutes two numbers, the systolic and the diastolic. Systolic is the top number. It is the pressure that the heart has to exert to pump blood across the artery. So a normal blood pressure is 120 millimeters of mercury for the systolic or lower. And for diastolic, it's that pressure that the arteries are seeing in between each pump. So when the heart is actively pumping, it's applying a systolic pressure, and when the heart is relaxing, we're measuring a diastolic pressure. And normal diastolic blood pressure is anything less than 80. So these are the categories of blood pressure according to the American Heart Association and American Stroke Association. Like I said, normal blood pressure is less than 120/80. You're considered elevated if you have 120 to 190 in the systolic range. Stage 1 high blood pressure or hypertension is 130 to 139. Hypertension stage 2 is anything greater than 140. And then you run into hypertensive crisis or an emergency when your blood pressure goes above 180/120. So hypertension is commonly known as the silent killer, and that's because we tend not to have a lot of the symptoms of high blood pressure until it becomes too late. So the only real way to check to see if you have high blood pressure is to get it checked regularly. And the American Heart Association recommends, ages greater than 20 to have regular yearly checkups of high blood pressure. And pediatricians do that even for kids too. So we should be, screened. Some of the consequences of high blood pressure that are happening in the background as we do not have symptoms until it becomes too late. So what are some of those consequences? Stroke. The blood vessels in the brain, they can, as they see higher and higher blood pressure, they can be at more risk or prone to burst or have plaque buildup on them or get a clot. So the higher the blood pressure gets, the more risk you have for stroke. Heart failure. So as the heart, anytime it has to work, it's a muscle, anytime it has to work harder to pump blood against those stiff arteries that result from high blood pressure, it is working harder and it is going to get enlarged. It's a muscle, it's working harder, so it gets enlarged and thicker and can lead to heart failure. So untreated high blood pressure can cause heart failure. Also, risk of sexual dysfunction in men and women. Vision loss, as the high arteries in the eyes are experiencing or being exposed to high blood pressure, they become more at risk. Heart attacks, so the arteries feeding the heart, if they're seeing constantly high blood pressure, they are seeing those stiff arteries. They're more prone to forming plaques and inflammation. And then another big thing is kidney disease. So we see a lot of kidney failure and kidney weakening, if you will, based on the kidneys seeing high uncontrolled high blood pressure for years. That can potentially lead to dialysis. So these are when what's happening in the background. What's happening if your blood pressure hits 180 over 120, that number, that crisis number I talked about? That's when you will see blurry vision, changes to how you're thinking, if being confused, suggesting that you're having maybe a potential stroke. Chest pain, if you develop that. Back pain, maybe sometimes suggesting that the main artery that feeds all of the vessels in your body is being torn or being injured because it's been seeing high blood pressures. If another indication of a hypertensive crisis or emergency is when the fluid builds up in the lungs immediately or urgently or suddenly, and that can cause you to get very short of breath, become low in oxygen. So that's also an indication. If you're pregnant, and your baby's been seeing high blood pressures, that's at risk for, having early delivery. So some of these emergencies are things to watch out for when your blood pressure becomes in that crisis range. Until it does, it's known as that silent killer. So I get a lot of questions about, what's the proper way to measure blood pressure? And I do tell a lot of my patients, and we'll go into it in a little detail, about checking blood pressures regularly at home. When I ask my patients to check blood pressures at home, you should not have had alcohol or a caffeinated beverage about half hour prior to checking your blood pressure. You should have rested at least 5 minutes with your both feet flat on the ground. Make sure that your arm is well rested at the level of your heart, the arm that you're going to be checking your blood pressure in, making sure that your cuff is an adequate size. If it's too small or too big, that can give you falsely high or low reading. Making sure you take at least 2 readings a minute apart so that you can average those readings. And then I tell my patients to check it at random times of the day. Some physicians say morning and evening. I like to sometimes see what blood pressure is after you've come back from work, and you've had a stressful day. Still following these instructions, but just to see some patients have a mid-afternoon rise after long days of work. So that's something to keep in mind. So how do you choose a blood pressure cuff? I say you get one that is automated and arm one rather than the wrist one. The wrist ones tend not to be as accurate. So I encourage my patients to get the arm ones and then make sure it fits the upper arm well and it's not too loose or too tight. And the other thing is you can check either arm. Usually when I see a patient for the first time in my office, we check both arms the first time just to make sure that they're somewhat in the similar ranges. Because if you do have a blockage and artery blocked feeding one of the arms is blocked, it can not erroneously, but it can read higher than the other arm. But for the most part, if you check between both arms, a 10 millimeters of mercury difference between the both arms is normal. So it shouldn't be reason to panic or become concerned. And the other important thing is you're doing the homework at home, so you should be bringing in what you're doing. So keeping a log of your blood pressure readings and measurements and bringing it into your doctor's office and showing them, okay, these are my readings. And going over that. And then the other big important thing is whenever you do get a blood pressure cuff, bring it into your physician's office and make sure you check it with their own measurements. So have them check it with your blood pressure cuff and the office's blood pressure cuff and make sure those readings are similar, because if you are getting different readings at home than every time you come in, there could be a couple of reasons, but one of them could be because your cuff is just reading maybe too high and needs to be fixed. So who should be checking their blood pressures at home? If you are been diagnosed formally with high blood pressure, you should be checking it. If there has been questions of you trending up, you should be checking blood pressures at home. And then there's what we call masked hypertension or white coat hypertension, 2 different things. White coat hypertension is every time you go into your doctor's office and your blood pressure always reads really high because you're anxious to see your doctor and the medical setting, but when you go home your blood pressures are perfectly normal and you're like, look doc, you're just making me nervous, I'm doing fine. And that may be, but what studies are showing or have shown is even if you have what the term of white coat hypertension, that is suggesting that every time you're anxious or nervous or stressed, you have a tendency to increase your blood pressure. So if you are at a stressful work situation, stressful family life, etc., then maybe your blood pressure is being higher at home at other situations when you're not immediately checking during those stressful times. So I don't tend to be too aggressive about controlling white coat hypertension, but I do tend to pay more attention and ask my patients to do more lifestyle changes to try to bring it down naturally. So I might not start medications right away, but I might encourage them to do the strategies we're going to talk about today to try to bring it down naturally and not just say, oh, you just have white coat hypertension, you're okay. And then the other thing is the masked hypertension. It's when your blood pressure is at home and outside, you happen to check at a local pharmacy, they're super high, but when you come into the doctor's office, it's normal. So those people should also be kind of paying attention to home readings and trying to bring in logs and compare. So what are some of the risk factors for high blood pressure? We'll go over the things that we can change, like being overweight, your salt intake, your alcohol intake, the level of activity, stress, smoking. And then there are some things that we just can't change. As we get older, our arteries in our body get stiffer, and we're at more risk for high blood pressure. African Americans are more risk for high blood pressure. If you have a family history of high blood pressure, you're at risk. So some things we cannot change, but a lot we can do. So first is changing the way we eat. A couple diets, the Mediterranean and the DASH diet, have been shown to decrease high blood pressure and be heart healthy in general, as well as cholesterol. And the DASH diet is termed dietary approaches to stop hypertension. And it is mostly focuses on fruits and vegetables, whole grains, nuts, seeds, and then less on, the animal protein, but eating lean meats, poultry, fish, and then even less on servings of sweets. So the DASH diet, can potentially decrease blood pressure up to 10 millimeters of mercury if people follow it. The next thing that we can do is to decrease excess sodium we take in. About 9 out of 10 Americans take in too much sodium, and it's everywhere. We say, Doc, I don't add any salt to any of my food. And I tell them that doesn't matter. It's been added for you, So you have to watch what you're actually taking in and what you're buying. It's, most of it is added in our groceries and then the restaurants we go to. And then kids who have a high sodium diet are twice as likely to develop high blood pressure. So it's important to start early and just, from where these sources come from, it's added in the bread and the rolls we take, the cold cuts that we buy at the grocery store, pizza, canned soup is, infamous for this, sandwiches. So just keeping in mind that you might not be adding the salt, but it is being added for you. And the current recommendations from American Heart Association say you should limit it to less than 1,500 milligrams. And on average, we are taking in twice as much. We're taking in 3,400. So we can reduce our salt intake by, more than 50%. So another big thing with high blood pressure is reducing stress, and that's easier said than done. I say go reduce your stress as if it's a magic pill, but there are ways we can reduce stress, making sure we are getting enough sleep, using relaxation techniques, meditation, yoga, deep breathing, all have been shown to help lower blood pressure. And I have actually a patient who comes into my office and he sits in the chair and takes several deep breaths before they check his blood pressure. And it comes out always perfect. And if we do it before he does that, it's 20 points higher. So he refuses to let us check it unless he does like 10 deep breathing. So that's that has been shown to be helpful. Giving yourself strong social networks so that you form jogging partner or exercise group, people that you can go work out with or spend time with will help with dealing with stress. Figuring out how to manage your time better, resolving stressful situations without letting them fester, and taking time for yourself, even if it's 15, 20 minutes a day to go for a walk, just to clear your head. sit in and have nice bath, those kind of things. Whatever you can do to relax yourself. And then at the end of the day, make sure you ask for help. If you are feeling like you're over your head and you getting stressed, turn to your family, friends, your physicians. So stress is a big thing for treating high blood pressure. Next is quitting smoking. So if I have one request for my patients who smoke is, rather than, more than anything, exercise, eating, whatever, quitting smoking is the biggest thing you can do for your heart and every part of you, diabetes, stroke, etc. So if you want the one thing to take away from here is to quit smoking if you're a smoker. That's will do wonders for your health. The benefits of quitting smoking just in the short term, in 20 minutes your heart rate drops if you quit smoking. In 1 year, your risk of heart attack decreases. In 3 months, your lung function improves. Your risk of stroke decreases almost to levels of patients who haven't smoked for stroke in 5 years. So it's a big deal and very, very, very stressed and important. So switching gears to cholesterol. So what is cholesterol? Cholesterol is a substance made by the liver and intestines. It's actually something our body needs. It's not bad. It is used in cell membranes. It's used to make hormones for our body. It's used for bile acids. And it also comes from the diet. So the liver makes it, and then we also take it in. And it's found in saturated fats, trans fats, simple carbs. And it's primarily transported in the blood by proteins. The two main ones are LDL, or low-density lipoprotein, and HDL, which is high-density lipoprotein. And why do we care about cholesterol? Well, it can lead to atherosclerotic and cardiovascular disease, such as stroke, the heart attacks, kidney disease, and peripheral vascular disease, where the arteries that supply your legs and your neck, they get clogged with plaquing and it can lead to stroke and what we call claudication, where every time you walk, the muscles in your legs are not getting enough blood, and so they cause pain with walking. And more specifically, in relation to the heart, you see that white yellow plaque in the artery of the heart, and that can get clogged with blood and form clots, and those clots can cause, part of that muscle in the heart to die and will lead to a weakened heart. So the plaque buildup is because of the high cholesterol. So a typical cholesterol profile when we order it, where we get total cholesterol, we get triglycerides, we get a number for the HDL, the LDL, and the ratio. So focusing on low-density lipoprotein, which is considered the bad cholesterol, it carries cholesterol from the liver to the blood, and the cells extract that from the LDL. Too much of it can deposit in the arteries, causing plaque, and as the plaque builds up, it narrows the blood vessels and it limits blood flow, which is termed atherosclerosis. And when the plaque breaks off, it can lead to heart attacks and strokes and also that peripheral vascular disease. So a typical LDL, ideally we want you to be less than 100. We're okay or near optimum when it's 100 to 130, considered borderline high, 130 to 160, high if it's 160 to 190, and very high if it's 190. But keeping in mind, these are numbers for patients who don't have diabetes, who don't have a previous history of heart attacks or stroke. This is just primary prevention. Haven't been diagnosed with anything, and off the bat, these are some of the goals. It changes when you have other medical problems and conditions. So high-density lipoprotein, the HDL, which is the good cholesterol, it picks up the cholesterol from the bloodstream and the LDL and arterial walls and brings it back to the liver. Ideally, the higher the better. So if you're above 60, great. If you're less than 40, not so great. So bad cholesterol is the yellow dots forming plaque, and the good cholesterol, the green dots, trying to pick up whatever cholesterol it can and bring it back. And you can see the plaque narrowing that blood vessel. The other thing, part of a lipid profile, is the triglycerides, which is another type of fat that is used as energy source in the body. It's basically made from excess calories and stored as fat, and it's included in the total cholesterol score. And it also leads to atherosclerosis and heart disease and stroke. So, the sugars and fats in your diet, whatever is needed, those calories are spent as energy, and then whatever you have left over is converted to neutral fat and stored. So typical levels for triglycerides, we want you less than 150. And it borderline high 150 to 200, high 200 to 500, and very high is greater than 500. If triglycerides are high, what we recommend is weight loss. If you're overweight, exercise, avoiding refined carbs such as white flour, rice, baked goods, limit your saturated fats, limit your alcohol. So a big thing was, we went from the all fat is bad message, several years ago, and that changed the dietary guidelines to replacing fats with carbs. And that instead has led to increase in type 2 diabetes and decreased intake of the good fats. So what are the good fats that is needed for our body? The monosaturated and the polysaturated fats. These have been shown to lower bad cholesterol levels. They lower the risk of heart disease and stroke, and they provide certain fats that the body themselves don't make, like the polyunsaturated fats. So they're important source for your body. A good source for these are liquid oils like canola, olive, sesame oil, nuts, flax seeds, sunflower seeds, walnuts, avocados, fatty fish like tuna, salmon, trout. These are all great sources of monosaturated and polysaturated fats. So these are the good fats that you should be taking to help lower your LDL levels. And then the bad fats are the saturated fats. They can raise your bad cholesterol, lower the good cholesterol levels, and increase your risk of heart disease and stroke. And these are mostly what come from animal sources, animal protein, such as beef, pork, chicken fat, butter, the whole milk cheeses, and then some of the coconut oils. I know, there's been a push about coconut oil being healthy, etc., but it is still full of saturated fat. So keeping that in mind about moderation. And then the really bad fats, or the ugly fats, are the hydrogenated oils or the trans fats, and trying to minimize the intake of these as much as possible. And these are mostly found in baked goods and processed foods and fried foods. And people have usually used these in foods for processing to increase the shelf life. But that has led to adverse effects on our cholesterol and our heart disease and our diabetes. And then switching gears to carbs, there is a difference. Complex or good carbs versus simple carbs or bad carbs. The good carbs are the ones that take have more fiber, and the body takes longer to digest. It has to work harder to digest, and the energy is released over a longer period of time. And these are whole grain breads, bran cereals, green vegetables, fresh fruits. They're high in fiber and nutrients, low glycemic index, meaning the energy is released over a longer period of time. You don't have the surge of sugar or energy, and you feel full sooner with fewer calories. The bad carbs, or the simple carbs, are those that when you eat them, you have an immediate spike in your blood glucose level, and then you have that crash afterwards. If not used immediately, the excess I talked about gets converted into fat and stored as fat for the rest of, in the rest of your body. And these are considered processed, like the candies, the desserts, sugared cereals, the drinks, the refined sugars. And they're low in fiber and nutrients, and basically empty calories converted to fat. So, just a picture of what whole grain means. It's keeping all the nutrients, and all parts of it is ground. When you process it or when it's refined, part of the germ and the bran, which has a lot of those nutrients, are removed, and only part is ground. So it might taste, fluffier and etc., but you're not getting as much nutrients from it. So sugars, in relation to the carbs as well, we should also avoid the amount of sugar we're taking in. Some natural sugars, we eat in fruits, our milks, vegetables, and then some are added to the foods we eat, and the drinks we drink. So watching out for the sodas. Sodas are big sources of added sugar, empty calories, even fruit juices, all the desserts, donuts, ice cream, etc. And then replacing those, with unsweetened beverages, or sparkling water if you like that soda feel, switching to fruits. And American Heart Association recommends limiting added sugars to no more than 100 calories, or 6 teaspoons per day for women, and about 9 teaspoons per day for men. So another big thing contributing to high blood pressure and cholesterol is your weight. And whenever you come into your physician's office, we're measuring your body mass index. And it estimates the overall body fat in your body. The higher the BMI, the risk of cardiovascular disease, diabetes, hypertension, all increase. And also where you store your body fat. So if you store it a lot in your gut, in the mid-range area, you're at more risk than if you store it at other areas like your thighs or etc. So keeping that in mind as well. How is BMI calculated? Basically, it's your relation of weight to height, and we ideally want you less than BMI of 25. And then the big thing is alcohol. So I get a lot of these questions. So alcohol, has been shown to reduce the risk of cardiovascular disease. It has some benefits in increasing your HDL. It has an antioxidant effect. There's a theory that it might be thinning the blood, with the alcohol, that maybe that's why you have that protective effect. But you should be drinking in moderation. The current American Heart Association guidelines say 1 to 2 drinks per day for men and 1 drink per day for women. No, and it's not just red wine. It could be, any alcohol. But I encourage my patients not to, if you don't drink, don't start just to get this protective effect. There are 1,000 different things you can do to lower your risk for heart disease than starting alcohol. So And then if you do drink, don't try to increase it to meet these 1 to 2 drinks per day to also get that benefit. You should, if you enjoy a drink a day, fine, but it also can lead to other things like stroke, cancer, diabetes, blood pressure. So just keeping that in mind. Exercise, multiple benefits of exercise. Current guidelines say for overall heart health, you should be exercising 30 minutes of moderate intensity, about 5 days per week, or 25 minutes of vigorous activity 3 days a week. And then also about 2 days a week doing muscle strength training. If you're specifically looking to lower blood pressure and cholesterol, bump that up to 40 minutes of moderate to vigorous activity, exercise activity 3 to 4 times. So, what you can get your heart rate up, unless you're on medications that bring your heart rate down. There are some blood pressure medications that do that. But in general, we want to, cardio means that your heart rate is up and it's sustained or kept up for that good half hour. I have patients who say, I go for a walk, and it's not just going for a walk and kind of smelling the roses, but, it should be a brisk walk where you're kind of, working a little harder to do that walk, huffing and puffing a little bit to really get that heart rate going. But I won't tell my 40-year-olds to go for a walk for cardiovascular exercise. They should be doing a little more intense exercise. And then sleep, big deal as well. The American Heart Association recommends about 6 to 8 hours of sleep. Sleep hygiene is a big deal. So, make sure that you're not going to bed with your phone in your hand and looking at things, because 1 hour might lead to 3 hours of watching your screen while you're in bed. Just as you have a set time to maybe wake up, you should also set a time that you should be going to bed so that you do get those 6 to 8 hours of sleep per night. The other big thing is it's not just quantity, so not just 6 to 8 hours, but also quality of your sleep. A lot of patients have obstructive sleep apnea where, the sleeping pattern or the patient's sleep abnormally pauses throughout the night, and that could be because their airways have become blocked from either, the muscles in the neck kind of compressing when they're laying down. Consequences of obstructive sleep apnea, a big deal is high blood pressure or fatigue throughout the day. Another big thing that I see a lot is arrhythmias, atrial fibrillation, any type of heart arrhythmias. Obstructive sleep apnea, treating that helps also treat heart arrhythmias. And patients, things to suggest or that you might have sleep apnea is having excessive daytime fatigue. If your partner tells you you're snoring and you stop breathing in the middle of the night for periods of time, gasping or choking for air during sleep, if you're irritable when you wake up and you're just, tired, those are all symptoms that you may be needing to get sleep apnea workup. Some risk factors, but these aren't absolute, is, the older you are, men greater than women, if you're overweight, and the neck circumference, the thicker the neck, more possibility of that muscles compressing the airway. So I do have a lot of patients who get treated for sleep apnea and their blood pressure becomes much easier to control. I'll have patients who we will keep adding blood pressure medications and then we'll screen them for sleep apnea. They start the CPAP and their blood pressures are much better controlled, and we're not adding those medications. And they themselves are feeling much better, more energetic, easier to lose weight as well. So it is a big deal in treating hypertension. And then what I do for a lot of my preventive care is what we call the ASCVD risk estimator. So it's an app. If you guys are tech savvy, you can download it on your phone. You can go on Google and put ACC calculator. And basically what it does is it gives you a 10-year risk of developing heart disease. And I do it for most of my patients that come in. It's a thing to start a discussion about what lifestyle changes need to be made, what kind of medications, or when to start medications, or how to talk about it. Essentially, you're basically answering 8-10 questions, such as gender, your cholesterol levels, if you're a hypertensive and you're on medications, your race. It was mostly studied in white Americans and African Americans, but it tends to maybe underestimate Asians and other races, but nonetheless, we still use it as a benchmark to start a discussion. And what it gives us, once we plug in those numbers, is a percentage. And the current guidelines say that if your percentage is greater than 7.5%, your risk of developing heart disease in 10 years is greater than 7.5. Current guidelines say we should have discussions about whether you need to be started on cholesterol-lowering medication. If your risk computes out to 10%, then we should have a discussion about whether you should be on blood pressure lowering medication, because the current guidelines for patients who can handle it are, treatment guidelines is to push the blood pressure goals lower to less than 120. They had been and some physicians still, shoot for less than 140 over 90, but if more and more research is showing that if we can push it less than 120 over 80, it's better, especially for those patients that don't have adverse side effects from it. So this is a good place to start the discussion about lifestyle changes, what medications, when it should be added, what your risk is. And then, a couple negative things, but the big one is it doesn't incorporate family history of heart disease. So that's why, it's a place to start, a launching pad for the discussion, but it's not an absolute. And then I know the primary focus of the talk was more lifestyle changes, but, at some point, because of genetics, because of age, because of gender, et cetera, what you do, everything you do in terms of lifestyle, might end up needing medications as well. And, there are a few main category of medications that we start for high blood pressure: the diuretics, the water pills, the angiotensin enzyme inhibitors like lisinopril or captopril, angiotensin receptor blockers like losartan, valsartan, calcium channel blockers like Norvasc, amlodipine, or beta blockers like metoprolol, atenolol, bisoprolol. So essentially, all these is either decreasing with diuretics, decreasing your blood volume so that your pressure goes down. The angiotensin receptors, the enzyme blockers, and the calcium blockers, they focus on kind of relaxing those blood vessels so that your blood pressure decreases. And then the beta blockers decrease your heart rate and decrease the workload of the heart, thereby decreasing blood pressure. They all have their own side effects, but these are the common categories of medications that we usually turn to. And then for cholesterol, the statins are the cornerstone for treating cholesterol in terms of medications. And they block the enzyme in the liver that is responsible for making cholesterol, called the HMG-CoA reductase. And possible side effects of statins are, what I educate my patients about is the muscle pain or joint damage pain, liver disease, so we're checking liver function after starting cholesterol because the medication primarily works through the liver. There is, this some risk of increased blood sugar, and there is this concern for increasing type 2 diabetes in patients who take statins. And the idea there is if you already, say, are pre-diabetic or you have a tendency to already have high blood sugars or are leaning towards full diabetes, then maybe the statin might push you over, but it doesn't, create or make patients who have no risk of diabetes to develop diabetes. And then rarely memory loss or confusion. So in summary, for blood pressure, know your numbers. Once again, the top number systolic, knowing the diastolic, normal should be less than 120/80. Elevated is, 120 above the 120 range, and then it goes in stages. And the big thing is lifestyle changes when you're in this elevated and stage 1 range. Focusing on lifestyle changes, the exercise, changing your diet, cutting salt, limiting alcohol, losing weight, stopping smoking, and de-stressing. And for controlling high cholesterol, ideally we want you less than 200 total cholesterol, knowing the difference between, your bad cholesterol and your good cholesterol, what foods that cause high cholesterol, and being overweight, family history, being inactive, and how to treat it. And similar to blood pressure, having a heart-healthy diet, losing weight, exercising regularly, and stopping smoking. So thank you for coming, and hopefully I gave you guys some ideas on what to do about decreasing blood pressure and cholesterol, or a little better understanding of it.
Okay.